Hello and welcome to Health Talks, a doctor-led vodcast brought to you by HDFC ERGO General Insurance Company. I am Hitesh Birani, Joint President, Accident and Health Business. Today we will be trying to cover a topic which is a topic which cuts across all ages, whether it is young, old, Gen Z, Gen Alpha, anybody. This is a topic which is impacting all of us in our day-to-day life, whether it is male, female or a child. I'm sure you would have guessed by now what is the topic. It is gut health. We have an expert from Mumbai, a leading doctor, Dr. Varun Ravindra Tadkalkar, a distinguished consultant gastroenterologist, hepatologist, endoscopist, and liver transplant physician at Fortis Hospital, Mumbai, with expertise in advanced gastroenterology and hepatobiliary sciences. Welcome, doctor. Let's start this session.
Thank you for the kind introduction. So we'll be discussing about common health issues regarding gut.
But what exactly do you mean by a gut health?
Gut health basically means you should have a proper digestion of the food without any symptoms like pain or nausea or vomiting, or if you pass a normal motion without we have something called as Bristol stool chart. Okay, there are 7 stages in that. So the basically the hard stools are 1 or 2, the loose stools are 6 or 7. In between, the stool should be between 3 or 4 or 5. We can consider it as normal. So you should pass a normal stool without any symptoms. That means you are fine with your gut health.
Right from childhood, we keep on hearing from our parents that we have to have a good immunity. Parents give immunity boosters also to kids. So does immunity has any relation with gut health?
Yes, definitely. So there are 2 types of diseases which can affect gut. It can be decreased immunity, it can be hyperactive immunity. Hyperactive immune system is called as autoimmune diseases. There are some diseases related to gut which are autoimmune. That means your own fighting system fights with your own gut cells. Okay, and it causes damage to your gut health. So that is one spectrum of the disease. Another is because of the less immunity. So as we all know that immunity is important against fighting pathogens, against fighting microorganisms. So if you are weak on your immunity, then there are chances that you might be affected with some pathogens, some bacteria, viruses, fungi, everything, and that can cause gut issues. So there is a spectrum of disease regarding this gut and immunity.
Interesting. And does gut health also have any relationship with smoking or drinking?
Yes, it has direct relation.
Achha.
So I'm basically, as a gut, I'm basically talking about your lumen, the intestine. It starts from your mouth to anus. From mouth, there is esophagus, the food pipe. Then we have stomach, in which food is stored for some time, and it passes forward into intestine, in which stomach is, the food is absorbed, and after that the waste material is taken out from the rectum. So this constitutes the gut. Along with this pipe, we have some other accessory organs which are very important for as a part of gut health. They are gallbladder, liver and pancreas. So as most of the people, we all know that this alcohol directly affects liver. Smoking, it affects all the organs.
So one more generic statement, and pardon me for this statement. I think whichever doctor you go to and take or put any problem on table, the first thing he will tell you that don't take stress. Stress would worsen this problem. So does gut also have an impact?
Yes.
If there is a stress level?
Yeah, it directly affects. So the people who are having anxiety issues, we are having high stress conditions, their nervous system is already hyperactive. Okay, so a small stimulus, small trigger is perceived as a significant trigger. So whatever symptom he should have, it is the symptoms are seen in more in quantity as well as quality.
Now, this is something which I always wonder in my life. I keep on hearing from my friends, my relatives, my neighbors कि ये खाना खाओगे तो your digestion will be good. ये नहीं खाओगे तो ऐसा हो जाएगा. दही खाओगे तो अच्छा हो जाएगा, सवेरे उठ के गर्म पानी के साथ नींबू लोगे तो आपकी डाइजेशन अच्छी हो जाएगी, वेट कम हो जाएगा, इसबगोल खाओगे तो हेल्दी रहोगे, वो तो एक सुपर फूड बन गया आई थिंक नाउ अ डेज. सो आर दीज in reality they work or are these all myths?
Yeah, it's not exactly myths. There are things which are actually useful, and there are things which are not actually useful. The useful things I can tell is curd, as you told, that it contains basically lactic acid bacilli, which are very good for your digestive health. These are basically probiotics. Probiotics, as in good bacteria. We have trillions of bacteria in your gut, your intestine. Most of them are good bacteria, and some are bad bacteria also. So when there is imbalance between this good and bad bacteria, you can have gut issues. So definitely curd provides good bacteria. So yes, curd is not a myth.
It helps.
Yes, it definitely helps. Second thing, milk. Many of the people have this milk intolerance. Whenever they consume milk, they feel bloated and all. It's very common thing. It is called as lactose intolerance. So it's not exactly the milk helps for this gut issues.
Understood. Understood. And a person like me who is a sweet tooth, after all meals I crave for sugar and sugary items.
See,
Does it impact my health?
Yes, it does impact in a negative way. Once in a while, having a sweet is fine, but consuming sweet on regular basis, it's definitely not advisable.
Does it have any direct impact on my gut?
Yes, specifically on liver. There is something called as non-alcoholic fatty liver disease, which is very commonly seen in the incidence. It's increasing nowadays because of our changing lifestyle, our eating habits. The NAFLD stands for non-alcoholic fatty liver disease. So people who don't consume alcohol, they also develop liver issues because of blood pressure, diabetes, high cholesterol levels, basically sedentary lifestyle. So this NAFLD prevalence increases because of excessive sugar consumption.
Does a sound sleep or adequate sleep or insufficient sleep have any impact on the gut health?
Yes, insufficient sleep, irregular sleep timings, your shift timings. So that also negatively affects the gut levels. It basically increases acidity, and people can have various issues like jalan or heartburn and bloating and all. So regular sleep, the recommendation is 7 to 8 hours a day, and with proper timing, that is the recommendation to maintain a good health.
Sure, sure. And I believe now India has become a diabetes capital of the world.
Yes, true.
Right? So does diabetes or hypertension have any relationship to a good or a bad gut health?
Long-term diabetes, the way diabetes affects the other organs like retinopathy, diabetes affects your eyes. Diabetes, there's something called neuropathy. Diabetes affects your nervous system. Same thing, diabetes affects your digestive system also. There's something called as diabetic diarrhea or diabetic autonomic neuropathy, in which patients have constipation and all. So yes, long-term diabetes definitely affects your gut health. Blood pressure, there is no direct relation other than NAFLD, as I told, fatty liver.
So if somebody, for whatever lack of knowledge, today is in a situation where his gut health is not good, can he improve upon it? Can he correct it?
Depends on what is the issue. So some of the gut issues can be managed with medicine. Some of the gut issues can be managed with long-term medication. Some of the issues require surgical correction.
If somebody doesn't know that he is having a gut health issue, etc., are there any external clinical observations or physical ways to understand that somebody is suffering from a gut health issue?
Yes, we call it red flag signs. Okay, those flag signs should not be neglected. One is unexplained weight loss. Okay, if you have weight loss of 10% over 6 months, this that, and if it is unintentional. Okay, if you are not doing any diet or if you are not intentionally making a weight loss and still you lose weight, there might be some problem inside. Second thing, if you notice bleeding from the motion, bleeding from the stools, that is definitely an abnormal thing. Third thing, if you are elderly and notice recent change in your bowel habits, so like 50 plus patients who have 3-4 महीने से motion बराबर नहीं हो रहा है, 3-4 महीने like since few months I am having loose motion, so there might be some problem inside. As we know that we are adapting to Western lifestyle, so in West the incidence of colon cancer is very high. Same way the colon cancer incidence is rising in India, and so specifically in people who are 50 plus, they should not ignore their symptoms.
Sure. One very common thing, at least in my house, is every single day I'm told कि आप salad खाओ. Is salad having a positive impact on
Yes,
gut health?
salads are having positive impact. They basically provide fibers, and fibers are good for your bowel movements. So yes, salad is definitely advisable. Along with it, as a part of NAFLD, we need to cut down the calorie intake. So if you eat a good amount of salad, obviously your stomach will be full with salad, and you will not eat much of calorie dense food. So it will help for NAFLD also.
So on a long-term basis, any last advice that you would want to give to all the viewers here in terms of how to maintain a good gut health, how to remain healthy on a long-term basis?
See, simple things. See, many of the diseases in gut are directly related to the lifestyle. Okay, the incidence of this primary gut issues is increasing because of the changing lifestyle only. So we routinely advise those who are having issues, or in general also, they should avoid spicy food. Okay, they should not be late night snacking. Okay, ideally there should be a gap of 2 hours between your food intake and lying down. Okay, in Bombay lifestyle, Mumbai's lifestyle, it's not possible to maintain. If you go home at 9:30, then you have your dinner. What time you are going to sleep then? But at least 1 hour we should do.
Thank you, Dr. Varun.
Thank you.
So nice of you trying to answer all these questions. I know many of these questions were tricky questions, but I would want to take this opportunity to thank you not only for answering these questions in a way and manner that it was not having any big jargons to decipher, and in a way and manner that a normal person can also understand it. At least I understood it. Thank you so much on behalf of everybody who is watching this show, clearing the confusions, and on practical day-to-day life basis, what are those things that we should be careful about to maintain a good gut health. Thank you for joining us. And before we wrap, here's a thought for everybody who's watching this show. Next time your stomach feels off, instead of just ignoring it, ask yourself, what's my body trying to tell me today? You will be surprised how often it knows the answer long before you do. Well, thank you guys. This brings to an end today to this program of Health Talks brought to you by HDFC ERGO General Insurance Company. This is a series of vodcasts that we have brought earlier to you also, and we'll keep on bringing to you. I would want to take this opportunity to thank Dr. Varun, who has spared his time today from his busy hospital life and has tried to answer all these questions in a way and manner that every layman like me can also understand it. Thank you, doctor, for this effort. For all those who have more queries and want to have those queries answered, you can DM us on @HDFC ERGO GI, and we'll be happy to revert back to you. Until then, stay informed, stay healthy, stay insured. Thank you so much.